Thank you. Thank you. Thanks to SAMCEDA, the board of directors, for this honor. We are really happy to be here today. And we really like the fact that we're in San Mateo. San Mateo has been our home really for the most of our company's existence. We're right at the Crossroads building at the 92 and 101 juncture. We just like it. It's a vibrant community and really one that is a great area with respect to attracting talent both in San Francisco as well as on the peninsula. Apixio is an applied data science company exclusively focused on healthcare. Our vision is to make healthcare and healthcare delivery more of a science than an art form, which it is largely today. I'm a physician by training. I went to medical school with the express purpose of trying to change the practice of medicine as opposed to practicing medicine. I'll leave that to my wife, who I met in residency, who's a practicing physician in San Francisco. We are in a very exciting time in healthcare today. As part of the Stimulus Act of 2010, the federal government and all of you as taxpayers have contributed over $30 billion for the adoption of electronic medical records in the hands of physicians, and now more than 75% of physicians are using an electronic medical record today. Healthcare is now becoming digitized in records that can be used in a way to learn a lot more about how we can deliver better quality, better affordable care. As Apixio, we like to think of ourselves in the forefront of that effort. We have developed a platform to acquire medical records and billing data and to use machine learning-based text mining techniques in order to read those medical records and all that's there to understand insights about the illness of individuals, the outcomes of their care, and the cost of their care in order to help bring about a better rational way of doing that. We, to date, have looked at over 1 billion encounter records or notes for more than 6 million patients. And what we've done in order to sort of solve the problems of today is our core solution looks at and determines the illness at a particular individual level, their diseases and the severity of diseases they're being treated for, to predict the future cost of their care and use that for the purposes of better management of their care and payment. And we do that for health plans and for physician groups who care for Medicare patients, as well as those that have acquired their insurance through Obamacare or the exchanges. And that's our first foray into creating for healthcare sort of the trust and the credibility that we can bring technologies from outside of healthcare to really inform the future. Prior to 5 or 7 years ago when I was training, we largely looked at handwritten records, and we basically decided on what to do from remembering what our training was and some studies we thought could maybe apply to the patients within our clinic at the time. It's not what we could do. It is flawed in part, and we can do better. And the way we're going to do better is we're going to take the real world information about each and every one of your care as reflected in these medical records and bring about a better cost, more affordable care. But it starts from being able to mine that data and do so across different practices, whether it's specialty care or primary care, and around different geographies and the like. So with our basis and our platform to create a machine learning model to decipher medicalese, physicians are taught to write not in English or Latin, but some sort of hybrid. So being able to make sense of it without people having to necessarily read it is challenging. So the basis that we have today with our customers that we're doing this for will lead us to the future we want to help bring about. Imagine if we can tell, based on your care profile, what works for you and people like you when looking at the data to see, based on what a physician did or a hospital did, what was the outcome, and was that the optimal outcome? right? And so what we're doing in terms of mining, determining care and the care profiles in the future we can use to personalize care and care recommendations, what I call the personalized health care of the future that isn't necessarily just genomics based. And so that's the kind of approach and innovation that Apixio brings. So what I hope is we can come back to SAMCEDA in a few years and be maybe one of those IPOs you see up there. But really it's about being able to bring to healthcare the innovation like companies like Facebook and like Google have brought to other areas. And since we spend 20% of our collective GDP on healthcare, wouldn't it be great if we can actually make healthcare more technology driven than just driven by anecdote, observation, and what I might have remembered from my training long ago. Thanks again for this honor. We really appreciate that and appreciate all of your support. Thank you.
So Dr. Darren Schulte, thank you, from Apixio.